Hi guys, Dr. Axe here, and we're going to talk about how to use sinus ozone. It's one of the most effective treatments I've ever come across at clearing out sinus infections and congestion. Okay, another reason that it works so well is because you're killing viruses, bacteria, fungus, mold. All these things build up in the sinus cavity. So I'm going to show you exactly how to use this machine. Okay, the first thing we want to do is we want to take our syringe here. Okay, and this is a 30 milliliter syringe. We're gonna put about 10 to 15 mLs in each sinus. Okay, so you could use a 10 as well and just use it on each side. Okay, so what we're gonna do is we're gonna take this, we're gonna screw it onto there. Okay, a lot of times you want to pull just a little bit so to make sure it doesn't, because it wants to get stuck right there at the beginning. So just pull it out a little bit. Okay, the next thing we're gonna do is we're gonna get the oxygen flowing. You're gonna turn this on. Okay, to make sure you have pressure. You're then going to turn this to a half. Okay, we want to start at a concentration of a half, and that's about 23 units. After you've done it one or two times, you can move up to 1/4. That's going to double your concentration, which is 42. Okay, so look at your settings on here, but you're going to start at 23. Okay, once the airflow is flowing, we're simply going to, once this is on, then we're immediately going to turn this on. And that's going to start the flow. Okay? So I'm not going to do it right now, but as that fills up, you'd see this thing start to fill, right? And you can help it a little bit to make sure it doesn't get stuck. It's going to fill all the way. Okay? So as soon as it's full like that, you're going to hit off, and you're going to boom, turn this to off. Turn the machine off. Okay? Now that it's filled, you're going to take this, and ozone's heavier than air, so you're going to leave it just like this. You don't want to get the ozone into your lungs because it can be damaging to the lungs. So we're going to take a deep breath in, hold it all the way so no ozone can get into the lungs. Okay? We're then going to do a quick half a pump, and that's going to burst the ozone into our sinus cavity. Okay? We're going to hold one nostril, take a breath in, and then we're going to hold it like this for up to 10 seconds to let the ozone settle in. And then when you're done, you're going to push it all the way out through your nose. Again, you don't want to breathe it in. You want to push it out through your nose. Hold the rest like this. And now we're going to do the other side. We're going to hold this nostril. Make sure this is nice and sealed around the nostril so it doesn't leak out around the sinus. So again, hold here. Quick pump, and then hold it. And then that's going to really settle into the sinus cavity. So again, start out concentration 23, one or two times so you get used to it. And eventually you can move up to a concentration of 42, which would be a setting of 1/4 on the nozzle there. That's how you do sinus. I hope that video helps, and we'll see you soon.